Hey everyone, my name is Sophia, and this is my presentation on case study 38, which is epidemiology of gastrointestinal illness and differentiation of Enterobacteriaceae. Okay, so first let's talk about Enterobacteriaceae. This is a large family of gram-negative bacteria that are commonly found in the intestines of humans and animals. They include well-known pathogens like E. coli, Shigella, Salmonella, and Klebsiella, and I also listed a few others. Many of these bacteria are linked to gastrointestinal illnesses, and they can produce toxins and invade tissues, leading to symptoms like abdominal pain, diarrhea, vomiting, and sometimes more severe complications such as dehydration or sepsis. Okay, case study overview, the outbreaks. So there were three different outbreaks. Let's start with E. coli. So this occurred between August and September 2016 in King County, Washington. The outbreak was linked to a restaurant called the Matador, where five individuals reported severe gastrointestinal symptoms, including diarrhea and abdominal cramps, with four of them experiencing bloody diarrhea. Three of them were hospitalized, but they all recovered. Investigation revealed that all five patients were infected with the same strain of E. coli, which was likely the 057H7 strain due to the bloody diarrhea. And it was discovered that some food processing equipment in the kitchen was unclean, creating opportunities for cross-contamination. And as a result, the restaurant was closed for several days, which they put up this little poster to allow for cleaning and sanitation. Okay, next was Shigella. So this outbreak occurred during June in Ventura County, California, and Shigella is a genus of bacteria that causes severe diarrhea, often mixed with blood and mucus. So people in this area complained of severe abdominal cramps, nausea, vomiting, and bloody diarrhea, which led to lab testing confirming that Shigella as was the pathogen. And the source of the outbreak was traced to a restaurant, which was Soup Plantation. And authorities quickly took action by closing the establishment and testing all employees. Thankfully, the outbreak was controlled quickly, but it highlights how human-to-human transmission of Shigella can cause widespread gastrointestinal illness. Okay, lastly was Salmonella. So this occurred during the first half of June 2017. I mean, not June, just 2017. And several hundred people across the US were diagnosed with salmonellosis, which is caused by the salmonella bacteria. And the patients reported common symptoms such as abdominal cramps, diarrhea, and vomiting. And salmonella infections are often linked to contaminated food, especially poultry. But in this case, 961 confirmed cases were linked to the backyard poultry flocks. The outbreak prompted the CDC to recommend stricter hygiene practices when handling poultry, such as proper hand washing and wearing separate shoes when collecting eggs. The CDC also highlighted that they need to fully cook poultry to prevent further cases. So, what do all these case studies have in common? First, they all stem from gastrointestinal pathogens that are part of the Enterobacteriaceae family. These bacteria spread primarily through fecal-oral transmission, which occurs due to poor sanitation, cross-contamination, or improper food handling. So how do we prevent this? So it is important to practice good hygiene, which includes washing your hands before cooking, eating, and after using the restroom. It's also important to properly cook food, especially poultry, to kill any harmful bacteria and ensure proper food handling, such as sanitation and food preparation areas to prevent cross-contamination. And then it's also important to just be knowledgeable of outbreaks that are happening. Um, for example, like if you knew about the Shigella outbreak, you could have prevented going to the soup plantation restaurant and getting sick. And then, in conclusion, the Enterobacteriaceae family includes some of the most common pathogens that causes gastrointestinal illnesses, and outbreaks can be widespread if not quickly controlled. But by understanding how these bacteria spread and how to implement proper hygiene and food safety practices, we can reduce the risk of infections. And that's all. Thank you for watching, and I hope you enjoyed.